The nurses would like you to view this video since you will be discharged from the hospital soon. Your nurse will go over your specific discharge instructions your doctor has left for you on your day of discharge. We know going home can be an exciting and sometimes stressful time for you and your family, so we want to try to help you get the information you need so you will feel more comfortable. The hope is this video will prompt you to remember to ask questions of your nurse as he or she goes over your discharge instructions so you will better understand your care once you are home. There are many topics your nurse will be reviewing with you about your care at home. These include your medications, any special instructions related to wound care as a result of surgery, supplies or equipment you might need at home, any restrictions to your activity or diet, and follow-up visits to your doctors. First, you need to understand the medications you will be taking home. You need to know about any changes the doctor has made regarding the medications you were on when you came into the hospital. We refer to these as your home medications. Has the doctor decided to have you quit taking any of your home medications? Were the doses of any of your home medications changed? Do you understand why the changes were made to your home medications? You need to know about any new medications the doctor has added that will be continued at home. What are the names of the new medications? Why were the new medications ordered? When and how do you take the new medications? What are the side effects of the new medications? Are there any laboratory tests that must be done to monitor this or these new medications? Be sure you understand the care of any wounds, incisions, or drains you might have. Ask questions about specific instructions. Remember, your understanding is important, so make sure you know how to take care of yourself before you leave the hospital. Clarify with the nurse that you understand the instructions. If you are in need of special equipment or supplies at home, make sure you have everything you need. Your nurse can make sure the appropriate people are contacted before you leave the hospital. The doctor has probably left specific instructions about your activity level once you get home. Be sure you understand what you can and can't do in terms of activity. Ask your nurse for specific examples if you do not completely understand. Your diet is another very important aspect of your recovery. Make sure you know if the doctor has left any special instructions for your diet. One last thing to make sure you know about before you leave the hospital is follow-up appointments. Your doctor will determine when you will need to return to see him or her after you are discharged. Here are some important questions. Make sure you know the answers before you leave the hospital. When do you need to go see your primary care doctor, and has this appointment been made for you? If you were seen by specialists such as a surgeon, a heart or lung doctor, etc., while you were hospitalized, do you need to see them and have those appointments been made for you? Do you need to have any x-rays or other tests and have those appointments been made for you? Lastly, once you get home, if you have any questions, we want you and your family to know you are welcome to call the nurses. We are available 24 hours a day, and you can call the nursing station on 3rd Central 3C at 865-545-6570. We are happy to answer any questions you might have about your medications or any aspect of your care.